Welcome to Finding Certainty with your host and U.S. Army veteran, Patrick Laing. Over the next hour, you'll learn from Patrick and his expert guests how to attract more certainty into your business and your life. Now, here is your host, Patrick Laing. Welcome to Finding Certainty with your host and U.S. Army veteran, Patrick Laing. Over the next hour, you'll learn from Patrick and his expert guests how to attract more certainty into your business and your life. Now, here is your host, Patrick Laing.
Welcome to Finding Certainty. It's our favorite day of the week for several reasons. I mean, we all look forward to the weekend, of course, but personally, I look forward to Friday mornings as we unpack, dissect, and analyze this topic that is so important. How do we find more certainty in our lives, our businesses, and in our communities? It's a question on a lot of people's minds these days, especially with the political climate and the presidential election coming up. You know, who can create more certainty? Who's going to help us have a great quality of life? Who's going to help us be able to sleep at night and know that our future is secure? Well, that's for you to decide. Personally, I have my own opinions, but today's guest on Finding Certainty has a solution that can help answer that question for millions of people all across America. We have the, is it president or CEO, Ken, of LifeExec? What is your official title? I know you're one of the founders, but...
Yes, the official title is president.
Head cook and bottle washer, right?
Exactly. Yeah, there's a lot of hats.
So our guest today is Mr. Ken York. He is one of the founders of a company by the name of LifeExec. He's a successful entrepreneur, having built and sold multiple companies over the years. In fact, your last company, maybe we can go into a little bit of the history, Ken, because it was pretty impressive what you did with the company preceding LifeExec. But before we go there, I always start out by sharing two reasons why I've invited this specific guest. First and foremost, I say if you want to be successful, surround yourselves by successful people. Look at those who have been there and done that. And Ken and his partner, Scott Mary, they've done exactly that. You bring two business partners together who have a track record of success. The next question is, what are they doing now? What are they doing next? And you want to try to hitch yourself to that bullet train, right? You want to be a part of what they're building. That's the first reason. Ken and his business partner, Scott Mary, what they have and what they're doing and what they have done is incredibly impressive. Secondly, though, they are filling a need, meeting a need that, as I said, millions of Americans have, and that is the need for affordable health care. I've actually had Ken on my show before. He was one of the earlier guests as we were starting Finding Certainty back in November of 2022. If you want to go back and listen to his original episode, it was aired on November 18th, 2022. And we went into some of his history and how the company came about and so forth. I'm not going to make him repeat that today. If you do want to hear it, I encourage you to go listen to it. Today, I want to jump right into this looming problem, this enormous problem of healthcare in America. And then we'll talk about how they're addressing this problem in ways that have never been done before. So Ken, thanks for being here on Finding Certainty.
Yeah, thanks for having me. 2022? Really?
Hard to believe, huh?
It was that long ago? Man, time flies. Okay.
Time flies when you're having fun. Yeah. So maybe just take 60 seconds. Tell us who you are, where you live, what do you do, and then we'll get into the show.
Yeah, Bend, Oregon, and so I split my time now actually between Bend, Oregon, and Phoenix, Arizona. Thankfully, because I woke up this morning, it was 25 degrees in Bend, Oregon, and I looked at the weather, and it's 70 degrees in Phoenix. So looking forward to being back there in the warmth. But background is, believe it or not, I'm actually, although we're in healthcare and health plans right now, background's actually in enterprise security software. Last time I was on here, I think I told you a little bit about that. The Yeah, the company that we had before, Ascension Software, we grew that business to being about 80 to 100 countries. What we did is we provided enterprise security software to protect guests as well as hotels. So basically, if you've been into any business center and used a computer, it was our security software that was protecting you and your session and your data and your identity during that session. And when we sold the company in 2016, we were in about 18,000 hotels around the world, and we're being used by about 80 million people a year. So I think most of your users have actually interacted with my technology in the past
without even knowing it, right?
Yeah.
Well, I'm glad you mentioned that. And I was going to ask if you didn't, because I think it's really interesting that you have worked in this space of protecting consumers.
Yeah.
Right? That was what you did. I mean, in 80 to 100 countries, millions and millions of people, you were protecting them and their families and the companies that were serving them. And that's exactly what you're doing now. You say, we're now in healthcare and health benefits and so forth, but it's also very much technology driven, right? It's technology related. There's things today like biometric apps and of course the internet, and of course AI and other things that are happening in technology that's making healthcare possible on a much different scale. It's much more affordable. It's much more, at least when you work with an organization like yours, right? Most people are looking at healthcare thinking, I can't afford it, right? Let's talk a little bit about the statistics. How many millions of people out there are either uninsured or underinsured? Because it's an enormous problem for the everyday American, right?
Yeah, it's nailed it. It's a gigantic problem. Every one of your users, it doesn't even matter what socioeconomic class that you're in. Everybody understands that healthcare, health insurance, health plans are really too expensive at this point in time. Right now, you have the average cost of insurance for an individual is about $700 a month. At least that's what it was last year. The prices have only gone up this year. For a family, though, Patrick, it's $2,200 a month is the average. It's over $24,000, $25,000 a year in health insurance. Actually, this last year, 2024, became the number one cost in the household spend. And for the first time ever, for a family, health insurance surpassed rent or a mortgage. The average rent or mortgage is number one expense. And with inflation going through the roof, right? It's that everybody's feeling the pinch. And so, and the result of that is that 65 million people, Americans, have nothing. They can no longer afford a healthcare plan. 60 million, an additional 60 million people. So we're talking about 125 million people have what we call, a low end or a catastrophic plan, like a bronze plan. Really doesn't provide a lot of coverage unless something catastrophic happens. And so effectively, that doesn't allow you to do the things that are necessary to stay well, to stay healthy. People are ultimately, and at any level, every single person is afraid to use their insurance because the cost is so high, so dramatically high after you're using insurance. I can give you some examples.
They raise your rates, right? When you do use it,
So what you have there is you have, you're paying, let's call it $2,200 a month as a family, but then you have a deductible.
Right.
And that deductible is, you're at the lowest end is $7,000 for a family. At the high end, it's $20,000. So that means you're paying $24,000 a year. But really what you have to do is you have to pay an additional $15,000, $20,000 after that out of pocket for your medical expense. And so it's dramatically, the cost is even more. Now here's what's worse. Once you start going and after you've met your deductible, you still have co-insurance. You have 70-30. So now they're going to split the bill with you. You have 80-20, 70-30. Get this, the programs I'm seeing this year, Patrick, you're not going to believe this. I'm seeing 50-50. 50-50. So you're going to pay $2,000 a month for insurance. You're going to have you're going to have to out of pocket. You're going to be $20,000 over and above that $24,000. So you have $44,000. Then when you get your bill, you're going to split it 50-50. People are terrified to use their insurance. The healthcare is broken right now in the traditional sense, and you're absolutely 100%. Right. It's getting worse.
Well, what I love about your backstory, Ken, about what you and Scott and your team do and have done, is you look at the problems
Yeah.
and then you fill them, right? And the whole LifeExec company and concept came about because of a tragedy that happened on Mount Hood, right? You were on a mountain climbing expedition, a storm came in, and you came through it okay. It was hairy, but there was a climbing team that lost a couple of people. And I remember you telling me that you said, if I had died on the mountain that day, my family would have not been taken care of like they should have been. That led to your creating the LifeExec software, which is an award-winning software. It protects your information, collects all your data. There's a patented delivery system, et cetera, et cetera. Well, I say that, and again, if you're interested in that story, go back and listen to the November 18th, 2022 episode. But I say that because you got into that service or that space and created that product that started protecting people's peace of mind, their assets, their loved ones. The feedback you started hearing, I think it's an important part of this story, because the reason you're in benefits now kind of evolved out of that experience, right? Do you mind sharing that little insight?
Yeah. So we're really proud of what we created. Thanks for bringing that up. We protect a lot of families. We've really helped a lot with that program. And yeah, you're right. So what happened in 2022? It was the Great Resignation. Everybody started quitting their jobs. Never happened in U.S. history. So 4.5 million people, both in 2022, 2023, and so a bunch of our partners started reaching out to us and asking us. And the reason why people are quitting their jobs is their employer couldn't provide affordable benefits, and so they were looking for employers that could. And so there was a massive this hit small business in a really big way. And the way that traditional benefit programs work is it excludes, unfortunately, the requirements exclude small businesses. 90% of small businesses, so 30 million businesses in the United States, didn't have affordable benefits for their employees, just simply because they didn't qualify. And so we're all about solving problems. We're all about helping, the little guy. We're about helping everybody. And so, and people have come to realize that that's what myself and my business partner, that's the passion. That's what drives us is identifying solutions that make a difference, because we live in the same communities, as everybody else. And when companies are thriving, when people are thriving, the quality of life for us goes, up as well. Just
For everybody. Yeah,
for everybody. And so we came to us. A lot of people came to us and asked us if we could identify a solution. And believe it or not, my business partner, we went out to lunch, and the place that we went for lunch, literally had a handwritten sign that said, "Sorry, we're closed because we don't have any employees." It literally said that. And so that was our call that, okay, this is the right path. This is something that we need to do. We need to start providing benefits that are available to all small businesses, all individuals, full-time, part-time, contractors. And so that started us down this journey with the mission of let's create affordable benefits that give people the ability to live their healthiest life.
Well, you hit a really important point. You said small businesses and individuals, right? I mean, talk about finding something affordable, something with good coverage for a small business. What about if you're an individual? What if you're a solopreneur or a gig worker or a single mom or something?
Right.
That's even more difficult, right? I mean, you can find benefits, but they're very expensive and they really aren't very good.
They're not very good, right?
At least until now.
Yeah,
right.
they're not providing access to the care that you need. And I guess, if we do a lot of data analysis. So basically what we do is we take a look at what do people actually need? What do they actually use? And how does the healthcare system work? And then we actually we work within the largest insurance providers, the largest carriers, the largest network providers that are out there, people that serve millions and millions of people and are the highest rated companies. And then we ask them to create a custom solution based on the actual usage and actual needs of people's health in the healthcare industry. What's amazing to us is been to us in this journey is how everybody within the space understands that healthcare doesn't work in its traditional sense, and they're all actually very open to creating a new solution, to producing something that's new, that's something that works. Nobody's doing it. The people that are currently serving the market within the insurance business have been doing it for 20, 30, 40 years, and they're standing too close to it. They've just been doing things the same way, and they've just been incrementally increasing their costs, instead of saying, hey, how do we disrupt this industry? How do we do things that can reduce costs?
How do we make it win-win, right? How do we make it work for us and our customers and the nation as a whole? That's the issue. Is I think you hit it. I think you're right. They've been so close to it. Mm-hmm. It's like a marriage that's going bad, right? It just happens because you're either progressing or digressing. You're not usually status quo. And if you don't step back, if you don't go on a date every week or something and get away once a quarter, your marriage falls apart, and you didn't even realize it was happening until it's too late, right?
But on the flip side of it, which has been just we thought we were going to meet all this resistance when we got into this. When we said, hey, we want to change healthcare, we want to make it better, and we thought everybody would be saying no and pushing back. And what we've seen is the people that are really a lot of the industry leaders are like, tell us more, right? It's like the
That's
first
really
time that they're getting this input, and there's a lot of discussion and dialogue for them to understand and really wrap their brains around what we're asking. But once they get it, they're actually just as excited to produce these solutions as we are. And what we have is changing. Right now, what we've released, and I know we're going to talk about it at some time, or at least I hope we do. It's like the first time anybody ever saw the iPhone, right? It was 2007, and Steve Jobs came out and he showed the iPhone. It was, oh my gosh, I've never seen anything like that before. And now you can't go to a store and not get a smartphone. Everything's a smartphone. And that's where we're really at with our program. This is where we feel with our program, Patrick, is we've created something new, something that works, something that's right, something that nobody's ever seen before. But we hope that, and we foresee, just based on the initial reaction to the market, the disruption that's creating, the light bulb moments that people are having, that actually in a couple of years, that every program is kind of based on this one. Now, we're going to be, of course, farther ahead by then, but everybody else, at least that's our vision. But we feel like every plan in a couple of years is going to be based on the foundation that we're creating right now.
Well, if for no other reason, it's because the people are demanding it. They're tired of the rising costs. They're tired of inflation in general, but in healthcare, it's the number one concern for most business owners, for most families. I didn't even know it's even higher than mortgages and rent now. That's baffling. I mean, mind-boggling, right, to think about. But I think it's, as we talk about this problem with 65 million Americans either uninsured or underinsured, I say this all the time, it's not because they don't want good coverage, right? Everybody wants to have that peace of mind, that certainty of having good coverage. It's that they can't afford it. Mm-hmm. We think of a single mom working maybe even a minimum wage job, trying to raise a couple of kids. How is she going to be able to get coverage for her kids? Well, you and I first started talking a couple of years ago, and we've gotten to be good friends since that time. It's been really fun watching your company grow and watching you roll out new programs. And we've been waiting for the one that you just rolled out. It's been very exciting, right? Seeing the kind of the behind the backstory and seeing it come together. But maybe we can talk first before we go into that, because we're talking about a program called Advantage Complete. It is extraordinary. I am a customer myself, as you know. I switched over from what I had before, but let's talk about where it started, because you came out with programs that are kind of the precursor. They're still available, but the precursor to Advantage Complete. And I loved what you used to say, and you still do. You say, some coverage is better than no coverage at all. Every single person deserves to have some coverage
That's right.
as much as they can fit in their budget, right? And you have programs that can do exactly that. So mind going back in history just for a year or two, and let's talk about that?
Yeah, fantastic. So when, I think it's an amazing journey, right? So we leave the restaurant that had closed, and we locked ourselves in a room with a bunch of really smart people. But what was interesting is smart people, but not necessarily health insurance people. We did have a few, but we have people from all walks of life. So what we want to do is we want to attack this from just that perspective. Is what is everybody dealing with? From a business owner standpoint, all the way obviously to an individual member standpoint. What do people actually need? And that's what we started. Started with what do people need, and we use, like I said, we use a lot of data. So billion people use healthcare every single year. That's pretty consistent over the last 3 years. And what we discovered was 34% go for wellness, 32, and I'll go through this kind of quick. 33% go for because they're feeling sick, right? I have a flu or a pink eye or something like that, some sort of infection, and then 32% go for an injury, have a cut, a bruise, and so it's 98% of all uses are those three things. 2% are the big things like cancer and heart attack and stuff like that, but it's 2%. And so what we looked at was, you're exactly right. We started with the mantra. One of our mantras was nothing is the wrong answer. When we found out that 65 million people have nothing, like that is so the wrong answer. And so what we want to do is say, hey, how do we meet 98%? How do we give people access to the healthcare that they need? Those three things at the lowest possible cost, the best programs, lowest possible cost. And
if I can interject, Ken, without paying for things you don't need, right?
Exactly.
Without paying extra for we all know this. I've heard you say this too, that 50% of medical expense is generated by, what is it, 5% of the population?
That's right. Yeah, you're right. There's a lot of big ticket items, obviously a lot of expensive medications that are used by a very small percentage of the population. And that's where a lot of your costs, that's why you have really high deductibles, because they're taking those premiums, part of those premiums, and they're shifting them obviously to where those costs are. So what we ended up doing is creating, as you said, 3 programs that we're very proud of, and they're available today, that are absolutely amazing. They give you access to, teledoc. They'll give you access, they'll give you access to primary care, urgent care, obviously. They give you pharmaceuticals, they give you dental, they give you vision. They even go farther than most medical plans, and they start at $1 a day. We have programs for $2 a day. One of our most popular program, until we released Advantage Complete, is $2 a day, and it is outstanding. I mean, and here's what's funny, Patrick, is that we have extremely wealthy people that use that program, and they love that program. People that are actually financially, they can afford anything they want. And this program, the services they provide are so good that they actually prefer that program over traditional insurance programs. So like what we've done is amazing. Very proud of it. And again, giving that, I mean, we've had people, and we have so many success stories of saving people's lives because they didn't have something. If they didn't have what we had, they wouldn't be with us today. We have people write us emails about their children, ear infection, like just things that they deal with on a day-to-day basis, that they were able to solve with $1 a day, $2 a day programs.
Well, you even have mental health, like unlimited mental health counseling for about that much a day for an individual.
Yeah, that's a good one. Right. And you're actually reminding me of all our great programs.
I'm a beneficiary of this because I've used your programs over the last 2 or 3 years since we've gotten to be acquainted, and because I like using what I'm talking about, right? We represent it at Certainty Management. I like to be a customer.
That's great.
It actually, I mean, you talk about stories of saving people's lives. I know you shared one about a lady who was having stomach issues, and she was just going to go to sleep, but her husband said, there's no it doesn't cost us anything. Let's just call the teledoc and see what he says. And he immediately said, you need to call ER. He has a few questions. You need to call the 911, get an ambulance here. Keep me on the phone. I want to talk to the ER people, the what do they call EMTs when they get there. And she had a blocked intestine or something. My mom went through that last year.
Yeah.
Earlier this year. He said if she had gone to sleep that night with a stomach ache that she thought she had, she probably would not have woken up the next morning.
Yeah, no, that's right. That's, and it goes back to that room that we were in. We were saying, what do people need? One of the things that came out of that think tank was that we didn't want any barriers between the services that you need when you need them as a result of cost. And that's what we were seeing is that one of the things that came out was people are afraid to use their healthcare because it's going to cost them more. And so one of the things that we said is, no, when you're sick or there's something wrong, you should never be apprehensive about speaking to a medical professional about it. And so we went out and we sourced Teladoc, the largest telemedicine provider in the United States. And if you go into Teladoc today, I think it's somewhere between $50 and $75 to meet with a doctor. And we negotiated it down to zero. We said zero, and they they're, well, what about $25? I'm like, no, zero. And so we were one of the first companies in the United States, and this is 2 years ago, to provide free, unlimited telemedicine appointments. And we did it for that very reason, is that we didn't want anybody to ever say, oh, you know what, I'm going to, just like the description that you just provided. And that was what they actually wrote us when they wrote us the letter about this. They said if it was a $25 fee, if it was a $15 fee, she would have tried to sleep it off. She wouldn't be with us here today. But because it was zero cost, because there was nothing standing in the way of them and speaking to a medical professional when they needed it, then they did it. And actually it results in significant savings, but it also results in, being able to, again, live your healthiest life. I have countless stories just like that of people being able to access instantaneously and knowing and counting on it and getting the help that they need when they need it, because we introduced that. And now what you're seeing, and like I said before, after we introduced it, we were one of the first. I think we were the first. I didn't know of anybody else that negotiated that. We're now starting to see that becoming a more pervasive solution within more traditional plans, is having access to healthcare providers at no cost. And, that's the disruption that we're creating, and really happy to do so. It's making a big difference.
100%. It's there's something to be said about no barrier to entry. I think the same thing with counseling. We've all gone through times where I could probably use a counselor. I'm dealing with some anxiety or some depression, or our marriage is struggling, and I don't want to spend even a $30 copay through my work plan, right? And so we just don't do it. We just try to soldier through. And
that's right.
Your plans with zero deductibles, and in many cases no copays,
right,
I think are not just giving people that peace of mind, but it's literally saving lives. Now, we are up against our break. We take one break during the show here, but when we come back, I'm going to share my own story from last year where my own life was saved because of this exact point. And then I want to get into where LifeExec has gone to this Advantage Complete solution, which is absolutely extraordinary. I think it's the answer that millions and millions of Americans have been looking for. And thank goodness it's actually happening, right? So we're visiting with Ken York. He's one of the founders of one of the fastest growing, one of the top BenTech companies in America, LifeExec. Don't go away. We will be right back here on Finding Certainty. All right, we're clear. We're still recording on YouTube, so
right on.
Yeah, it's kind of fun doing this interview because I feel like I know the story so well, probably more than any other interviewer.
I know your story. I'm looking forward to hearing it. We had a cool one. We had a neat one. There was a lady, and she was having some serious health issues. She didn't know what was happening, and with her really concerned, healthy lady too.
Uh-huh.
And all of a sudden started having all these issues, and went down, and through our program, she was able to get full set of labs at no cost, and she had to go for like major diagnostics, and they were like, yeah, this is going to be $4,000 for intensive labs. So it was like $3,800. And she goes, well, I have this program. She gave me the program. They're like, oh, it's no cost. Here you go. And so she's like, okay, great. She did it. And then,
$3,800 or no cost.
yeah,
Which one
right?
do you want?
And there was like, yeah, no out of pocket. And she's like, no deduct, like there's nothing. They're like, no, it turns out the whole thing's paid for. And even they were like, don't know if I've ever seen this before. And I always love that
computer screen, right? Is this right? Hold on. Let me call the office.
Yeah,
Hold on.
yeah.
You are listening to Finding Certainty with Patrick Laing. Have a question for Patrick or his guests? Join us on the show at 866-472-5790. That's 866-472-5790. Now, back to the show with Patrick.
We're back. I was visiting on the break with Ken York here. He's one of the founders of LifeExec, and we were talking about examples of one in particular, one of his customers who was used to paying $150, $200 for the prescription he'd have each year, or each time he used it, and literally going in with this program, with his LifeExec program, and being able to pay zero. This whole conversation around barrier to entry, Ken, I think is a really important one, because even if it's $10, right? It could be a $10 copay on a prescription, or a $30 copay on a counseling session, or whatever, right? I think it's more a psychological thing than even a financial thing for us. We're like, I'll just sleep it off, right? or we'll just try to figure it out from a counseling standpoint, or what, we just, I don't know. I don't know what it is and why that is, but I know I think the same way. And whether I'm a cheapskate or we work so hard for our money, we hate to pay it if we don't have to. I don't know what that reasoning is, but it is absolutely a fact. It's absolutely a factor in our decision making. Now, as I said before the break, it was last year, in March of last year, where I was on a business trip in Arkansas. I know you've heard this story and about my appendicitis, right?
Mm-hmm.
I was visiting a business partner. We have an engine that we're developing with an inventor in Arkansas, and we were there. We came in the day earlier because we were going to go fishing up at this world famous river called the White River. They pull 50-pound trout out of this river, just so you know. But so I was really looking forward to it. I'm a big fisherman. We drove 3 hours up through the Ozarks up to this river, and the whole time I was feeling just kind of sick, right? Stomachache. And I was laying down in the back while they were driving and talking. We get there and I said, okay, let's go fishing. And my business partner, Frank Hellring, he said, you don't look very good. I said, it's just a stomachache. Let's just go. I mean, it's the first time we've ever had words, right? Because I wanted to go fishing and he put his foot down. He said, you look sick. And we get along great, but that day we had words. So he said, I'm putting my foot down here. I'm half of this business, this partnership. And he forced me to get back in the car, and we drove back to Ozark. We were 3 hours out in the middle of nowhere, right? We were going to be up the river on a boat. Well, we called a teledoc because of my LifeExec, picked up the phone, called them, gave him the symptoms I was having, asked a few questions, and he said, you need to immediately go to the ER. He says, you have every indication of appendix that has not burst yet, but is about to. And we went into the ER, and they put me right in. 2 hours later, I had surgery. They got it out before it burst, fortunately. I literally was out of the hospital that night and went to a business meeting the next morning.
Wow.
Which they thought I was crazy, but he said, I think Frank saved my life, but if I didn't have that telemedicine I don't know if I would have called. Maybe I would have eventually gone to the ER, or maybe I would have gone back and laid down at the hotel and tried to feel better. But because I had that benefit, I used it, took his advice, Who knows what happened, but it could have very well saved my life. And, as we talk about this new, so thank you, Ken. I appreciate it. I appreciate you.
Happy to help. Yeah.
I appreciate you, doing what you do. But, the long and the short of it is that program that you started with, the LifeExec Essential Signature, these other plans you had, it's morphed into and it's evolved into a much more comprehensive plan that I want to talk about now. We call it Advantage Complete for a reason, right? Mm-hmm. It's the complete package. Mm-hmm. I mean, it has so much value packed into it, and it has the elements and the benefits, the protection that we need and want, and nothing else. It doesn't have a bunch of other things in it that we don't need, right? Like so many things do. We're paying for that 5% that are sick. We're paying for benefits we will never use.
Sure. So and actually it has.
Let's get into it. Let's talk about what it is.
Okay. So, instead of just giving the tip, I think the pitch, it's more about the philosophy, right? Let's just, of what we were trying to achieve. And ultimately what we were trying to achieve was, we started with, let's give people the best possible healthcare that they can get. And that's like, let's forget about costs first and foremost. Let's focus on the best possible care, because that's actually a big problem within traditional healthcare right now, as is. And what I mean by that,
they try to give as little as they can and at as high a price. Right?
Exactly. And it was when we started this conversation with today, you said a really interesting thing, because it was you started talking about technology as well, and that actually, believe it or not, plays a part in what we were able to achieve. And I'm going to circle back around that. I'll interject that as well, because obviously that's my background, and we're able to achieve a lot of have a lot of wins here as a result of technology that and ultimately end up reducing the cost dramatically. And so, but we started with best healthcare. And so what that meant was, so when we took a look, is first and foremost, we want the biggest network that's out there. One of the things that, and a lot of these things are pet peeves of, I think, everybody that's out there, is I hate like the concept of being out of network shouldn't exist. Like that just shouldn't, you should never be out of network. And so when we travel in the United States, it's like I live in Bend, Oregon. I drive to Portland. I fly over the United States. If I use a traditional program, as soon as I leave, my area, then I'm out of network and I'm paying out of pocket, yet I'm still paying so much money for our premium. So where we started was a nationwide network. So all 50 states, 1 million doctors. I've yet to see anybody that hasn't found their specific doctor within this network. Pretty much every hospital. So, 8,000 hospitals and facilities in the United States. That's where we started. The second thing that we did is we turn around and we say, you're paying money for this. Like we said, we're coming back, was we don't want people to not have a reason to use our program. And everybody's afraid of using healthcare because of the deductibles and the coinsurance and all that good stuff that go along with that high premium that you're paying. And so the second thing we did is we set a $0 deductible. It's a really big deal. That means that you can go in and that your health insurance is going to kick in $1. You already know that we're dramatically lowering your costs, or in our case, we're going to pay for almost 100% of everything. In most cases, you're getting a return on investment. When you start paying $2,000 a month for something, it's an investment. You should be getting something. You shouldn't have to pay more money. You should be able to get something out of it.
100%.
And that's actually that's the thing, and why you said we took so long to bring this solution to market. That was our biggest obstacle. Wasn't the nationwide network. That was the easy part of it. The biggest obstacle was the $0 deductible. If you're going to go find a $0 deductible plan and out there right now, I mean, they're so expensive. They're $3,000. I mean, they're like, or more. And so ours it was $0. So those are the two things that we started with and we were able to achieve. And what that means is people can go anywhere. They can use healthcare. They can use their own doctors. They can use their own hospitals, their own urgent cares in their neighborhood. And they're not discouraged to do so by their insurance. They're encouraged to do so because they know their insurance is going to be there with them.
Well, you you hit a really important point, because we talk about this whole concept of barrier to entry, right?
Mm-hmm.
It's not just the little copay, it's the multi-$1,000 deductible, because how many of us
That's right.
think, I don't know, I can't afford that right now. I even if I could, so many families in America are living paycheck to paycheck with the rising cost of healthcare, but also the rising costs of everything. I mean,
That's
just
right.
inflation, groceries, gas, et cetera,
Right.
et cetera. We're tight, right? And so I also think it's important to mention that it's guaranteed issue, right? I know that's a big hot button for you, is that every person who wants this coverage can get this coverage, which is, again, almost unheard of, right?
Yeah. Yeah, no, it's, yeah. I mean, it's something that just, it almost pulls at your heartstrings to think that you have with healthcare, it's healthcare.gov, right? It's a government, these government backed programs should be available to all Americans, and they typically are, but they reduce the benefit is that they're giving to a lot of folks. With ours, it's like you said, it's available to every single person. You can have pre-existing conditions. There's no knockout questions. Like I said, it's our mantra is to help everyone live their healthiest life, and so that we made it available to everybody. What's kind of interesting, what you talked about, we were talking about medications, and you're talking about the no barrier to entry. When we started, one of the things that we did with this, Patrick, is we said, okay, nationwide network, $0 deductible. Our insurance pays for more things. Like when you end up getting a bill because there's a $0 deductible, like with an appendectomy, I always like to use that one. It's going to cost about $18,000. With traditional insurance, if you had a $20,000 deductible, that the whole thing's out of pocket. With ours, we pay $1. We don't cover everything. Insurance doesn't cover everything either. But your net cost is going to be about $4,000 with us with an appendectomy. With a traditional insurance, you could be paying for the whole thing. But say you had a silver program, a pretty decent one, you're going to be paying about $11,000 of that. So our insurance is even better. So we pay for more things. But like I said, everything that we do is data driven. And one of the things that you mentioned kind of struck a nerve for one of the things that we did is what's preventing people from using healthcare. And a statistic that absolutely blew our minds is that 60% of people in the last few years, because of inflation, are not filling their prescriptions for chronic diseases. So let's say I have high cholesterol. I'm no longer fulfilling that prescription because 10 to 20 medications fall off an insurance formulary every single year. Now my medication's not on there. Now I have to pay out of pocket. Now I'm $200. I'm $300 a month for this. I can't afford it. And I can't really see cholesterol as a problem in my life. So I'm foregoing that. So what we're doing is we're creating future medical cost increases because of what's happening with the lack of coverage. One of the things, so as a result, one of the things that we did with this, and I think everybody's maybe familiar with things like GoodRx and stuff like that, like discount drugs. Well, we've created a relationship with the largest pharmaceutical distributor in America, and they provide medications to 65,000 pharmacies. And we went to them, we said, hey, we want a customized medical program for us. And they're, oh, okay, we do the GoodRx, they supply drugs for companies like that. We can get you guys drugs for 70 to 80% off. We said, great. I was like, we would like 100% off. We want zero cost. And we don't, again, it's kind of like the Teladoc thing. We don't want anything standing in between, even if it's a couple bucks. I don't want anything in between our members and the medications that they use. They had never received that request ever. They went back, took a look at it, gave us a price. That price that we built in now to Advantage Complete includes 3,000 medications. 98% of all the medications that are prescribed within the United States are now available to our members, zero cost. There's no limits to the number of medications that you can have simultaneously. There's no limits to the number of refills that you can get. There's literally nothing standing in between you and the medication that you need to stay healthy.
There's a lot more to this. You know, as you look at this, you can look it up at certaintybenefits.com if you want to. Go to www.certaintybenefits.com and read all about this. But I want to go back just a minute to the appendectomy example. I mean, sorry to belabor the point, but the numbers you gave are exactly right, though, right? My appendectomy out of pocket was about $18,500 minus the deductible, minus the coverage. There was about $7,000 left that I would have had to pay in person, even with a Blue Cross Blue Shield, silver plan or something like that.
Yeah.
With your plan, this Advantage Complete, I've compared it side by side. There was about $3,500 left that I would have had to pay for out of pocket, but we missed it. We kind of passed over a really important piece of this Advantage Complete plan, right? And that is that it comes with this $100,000, you call it a life protection fund.
Yeah.
You mind explaining that? Because that's a really big piece of this.
It's a big deal.
In my case, would have eliminated, I wish I'd had it at the time. I didn't, but it would have eliminated that $3,500 remaining bill. Right.
I mean, one of the things that, I'm going to be honest, one of the things that actually breaks my heart about insurance when we start taking a look at insurance is that the number one cause of personal bankruptcy, in the United States, and for a very long time, this isn't new, for a very long time, is unexpected medical costs.
I believe it.
Just think about that for a second. As a family, you pay $2,000 a month to insure your family. You're insuring your family for financial protection for medical costs. That's what insurance is. You turn around and something major medical happens, right? You have an appendectomy, you have a car accident, you have something like that, and now you have $50,000 of bills. But because you have no disposable income, because your income's going to insurance and rent and the increasing costs, that you don't have that money. And because you have a high deductible, because you have a 70-30, co-insurance, you're now subject to $20,000, $30,000 of bills. And that's causing you to go into bankruptcy. When we took a look, I took a look at that, and my business partner and I said, literally nobody at LifeExec, no members of LifeExec are going to declare bankruptcy as a result of if they're using our insurance. So we give you our insurance, Patrick. So what we do is we say, okay, here's our insurance, $0 deductible. And now we're going to pay more than traditional insurance coverage is going to happen. But as a result, there's always a net. They're not always, but with big things, there's limits to coverage. And that's what we're talking about right now. This with us, like your appendectomy, I'm going to use that example. You'd have about $4,000 left over. Well, what happens if you don't have $4,000? And so we give you a second policy, so completely separate from your insurance. We give you a separate policy, standard. This is part of this. We call it the Life Protection Fund. It's $100,000. So what you can have is if you have a major medical cost. So this isn't for like Band-Aids and aspirin and stuff like that. If you have a major medical cost, you can pull from that $100,000 to pay for your costs. So your insurance covers everything but $4,000. You have $100,000. That is your account. That is your money, by the way. You pull from that, you can pay for that. So if you had an appendectomy tomorrow, your out-of-pocket cost is $0. And you still have $96,000 left over.
I love that.
Yeah, it's a big deal.
And there's more, right? There's a burial benefit. If you die, your family gets $15,000 within 24 hours. There's some long-term care coverage. You have so much packed into this.
Well, I'll tell you, Patrick. You talked about the teledoc and the telemedicine. I'm so excited about virtual health, and I live in a rural country. But personally, I just don't like driving. I don't like setting up an appointment, waiting 27 days, driving down to the doctor, sitting in the office for 15 minutes
with a bunch of sick people. Right?
I don't have the time to do stuff, unfortunately, like that. And so I went back to Teladoc and I said, okay, I'm creating this new program. I was like, what else you got? I love your company. What else you got? What they gave us is virtual primary care. So one of the things they gave us is virtual primary care. So what that means, so you have urgent care is what you were talking about. Now I can go hand pick my doctor, then see him over and over and over again. and I can have this person virtually, which is really interesting because a lot of times I don't need to go to the office. I have a question, or we're going to review my labs. So I can do that virtually with this person. I can also have my in-office. Now this is cool. I have my in-office doctor here. It's my same doctor I've been using for the last 8 years, and I have them as well. So I have my choice between two, but they both personally know me. Now what's really cool about this is that if something happens, if Dr. A tells me something and I'm like, I don't know, I can automatically get a second opinion with somebody who also knows my health. So we did that. That's available, unlimited. It's free, which is, I think is really exciting. I haven't seen anybody do that before. That's brand new. I picked up my doctor. He's great. And then the next thing that we did as well is we expanded our mental health program. So again, you can get unlimited mental health. You get therapists, you can get counselors, unlimited. It's free to use. And what's cool about ours, same thing, is that you can do it in the privacy of your own home. And we released our initial mental health program, and that's what people actually came back and they were like, you know what, I don't like driving down, to my therapist, getting out, parking out, because I live in a town and I don't want, there's some sort of stigma, right? I don't want people, seeing me go into this and thinking anything. I don't know why people think that. I think mental health is something everybody should have a therapist. Everybody should have somebody to talk to, a professional. But just having that ability to do that in the privacy of your own home is people are now using it. And they're able to deal with issues, and they're more willing to deal with their mental health as a result. So all these things, yeah, you're right. All these things are included, no cost.
It's incredible, Ken. I mean, it's been fun watching you build it and evolve and become what LifeExec is today. I mean, you grew it from just an idea to a concept, and now it's just it's a driving force that's going to change the lives of millions. Now, we're coming up toward the end of the show. I think we should have you back on just to talk about what's coming, right? And maybe take 60 seconds, if you would, and talk about this new cancer program that is on the horizon.
Yeah,
because that's a question everybody has. What about cancer? What do we do?
I appreciate what you said. And a lot of everything that we're doing with Advantage Complete was actually driven by our members. Like, what do you need? What do you want?
Yeah.
And when we roll this out, the number one question is, okay, we've addressed 98% of all things, and actually Complete addresses everything. But one of the things that the number one question that we always get or concern is, I know I have insurance, regardless if I have traditional insurance or I have your insurance. I'm concerned about cancer. Everyone says I'm concerned about cancer, and it's that and heart disease are the number one killers in America. So people should be concerned about it. We ended up digging in. Like I said, we like to take a look at how do hospitals work? How does the medical community work? And what unfortunately we didn't like how people were addressing cancer and how hospitals, because they do a one size fits all. If I come in, I'm diagnosed with one cancer, I get the same treatment as everybody else. The problem with that, Patrick, is that cancer, no matter what cancer you have, is really you have a specific type of cancer, but it's also very specific to your genetic makeup. Mm-hmm. So your cancer is individual to you. So there is no one size fits all. You don't get one pill, one set of chemotherapy, and that doesn't cure everybody. And that's how hospitals work, because that's how they're getting compensated by insurance. Insurance is going to pay for this treatment. It's how they, and they have to do that too for cost standpoint, right. Understand what the cost is. So they're not able to individualize your cancer treatment. That's why a lot of cancer treatments that aren't successful. We ended up, so we really got into this. I want to give people the best possible cancer treatment that they can. So I ended up discovering what was the top precision integrated oncology center in the United States. In fact, it's one of the top integrated precision oncology centers in the world. That means is people with cancer from all over the world, go to this place. It's 100% private pay. They specialize your cancer treatment based on your genes. Their success rate for a hospital is here. Their success rate is through the roof. People come to them with stage 4 cancer and they cure it.
Wow.
This is amazing. The technology is incredible. We are going to be the only company in the United States that will have a monthly program that will give you 100% of your diagnosis, your counseling, and your treatment, completely covered, $0 deductible. We will give you the best chance of curing your cancer, and the cost is going to be astronomically low. So that's the next thing that we're rolling out. We're going to be having it in about 2 weeks. We'll be signing the paperwork hopefully in about 2 weeks. We'll be rolling it out probably around the first of the year. It will be the best cancer program available in the world, and definitely within the United States.
Well, with two grandfathers who both died of cancer, I will be the first one on your list.
I think you'll be second.
That's right. It's a good place to end on. We're up against the end of the show. I definitely think we should have you come back on once you roll it out. Let's dig into that program in more detail. We can answer any question. Maybe we'll open up to the listening audience and get some Q&A going. And I really appreciate you being on again, Ken. I really appreciate your relationship. We're big fans of everything you're doing. And for those of you listening out there, there are answers, right? We're out of time, but we're not out of solutions. There is certainty out there. We can help you find it. Ken can help you find it. Again, go to certaintybenefits.com to learn more. Have a great weekend, everybody, and thanks for being with us here on Finding Certainty.
All clear. Great show.
Thank you, Jordan.
Well, hope you both have a great rest of your day.
You
Thanks.
too, my friend. So we're still recording, Ken,
Awesome.
on YouTube. I know we kind of rushed at the end. We ran out of time a little bit there, but the cancer is a whole show all by itself, right?
I'm
The cancer treatment.
I'm going to tell you the stuff I have to share on that. It's going to absolutely blow your mind. It's I said we're still recording. Yeah. So it's okay. So when top precision integrated oncology, I'm getting a whole education on this as well.
Yeah.
What that means is that this, and when you go to this facility, Patrick, it's not one building, it's not one office, it's 5 buildings. It's a campus
With multiple campuses across country. What did you say, about 13 or 14 different campuses?
Correct. Yeah. And it's run by the most passionate and probably the best oncologist in the United States.
That's great.
And what he does, so when we start saying precision integrated, what that means is they don't limit themselves to just, it's the NCCN guidelines. So basically, if you come in with a diagnosis for cancer, there's actually, they call it a cookbook. Physicians actually oncologists call it a cookbook. This is what you have. This is the treatment. Now, and like I said, it's just generic. It's based on clinical studies. And so you're going to get the same treatment that I would get. Now, what they do is they'll go in, what this place does is precision, right? So the precision portion of this is they're going to go in and they're going to take a biopsy of your tumor and they're going to do a genetic study of it. And that genetic study, then we're going to take a look at what kind of medications are required to diffuse this tumor, and specifically based on your genes. And then they test it in a petri dish. Basically, if it kills the cancer outside of your body, it's going to kill the cancer inside your body. So then what they're doing is now they're integrating. So now they take a custom set of medications. So they have a compound pharmacy. They create a medication specifically for you, specifically for that tumor that they know that's going to work. And what they do is they have hair-like basically tubes, and they go directly in just to the tumor. So they're not giving you chemotherapy that goes throughout your body, right? The whole thing. And that's why you feel sick. And that's why they actually stick it right into the tumor. They inject the medication specifically into the tumors. And they can do this all over your body. And then they get the treatment. Now, what's really cool about this is one of the things is, and I was literally talking to the oncologist yesterday, is that the dosage, one of the biggest benefits of that about doing this is not only is that it's specific and they know it's going to work, they know it's going to be effective, highly effective, but they also are going to take the dosage from here to here. So you're getting far less chemotherapy and chemotherapy being the chemicals, the drugs, the chemotherapy than you're going to get traditionally. So you're not having this adverse effects. You're not feeling sick. You're not drained. You're not all the adverse effects that come with chemotherapy are significantly reduced. They have people that they'll come in for chemotherapy and they'll leave and they'll go for a hike the very next day, like that type of thing. It's called ablation therapy. It's absolutely amazing.
were you saying something too about how they take the blood out, treat it, and then put it back into you? So there's something to do with that?
Yeah. So I'm.
You were telling me about that the other day. Yeah, that perked my ears up.
I was on with a bunch of attorneys yesterday, and I'm not allowed to talk about it because it is technology that only like, I want to say it's machines that only like have 5 oncology clinics in the entire world have.
Wow.
They have to dramatically reduce. Yeah, so you got some really top secret information yesterday. To dramatically improve how you feel after you have chemotherapy. It's absolutely amazing. But here's what blew my mind yesterday, Patrick, is that they specialize in what's called late stage cancer. Like stage 3 and stage 4. So basically, when you go into a hospital and you get a treatment and that treatment doesn't work and now you're terminal, they're telling you go find hospice. Like literally go find hospice. Yeah. Those people will go to this and it's actually called a center of excellence. So a specialized center of excellence. They will go to this center of excellence. And again, people flying around the world for this. They will treat after a hospital said you're terminal. They will treat them and they will cure them.
Incredible.
And that's what I'm so excited to bring up. We will fly you in. We will find the oncology clinic that's right for you, but this one I love just because I've toured it and I met the guy. And they will fly you in. They put you at the hospital. They give you the treatments. Treatments last, I think what they tell about 12 weeks. So you stay there for 12 weeks and you leave, and you're good. And and that's what we're gonna start delivering to people. I'm so excited about this place and about this facility. I'm going back in 2 weeks, and I'm really looking forward to getting this one out to market.
Well, the timing is very ironic. It makes me almost want to catch cancer just so I can go experience it. Right?
I'm telling you, I feel a lot. Of course, I know that you're being sarcastic about that, but it is something I didn't realize even. I mean, we don't have a lot of cancer, and not until later on in life and in my family. But you don't really notice, you don't realize that you carry around stress like subconsciously. And when I went through there, and I don't know if you've ever been to like a chemotherapy area, but it's really depressing. And like when you go to one in a hospital. And it's dour. I mean, obviously it's this incredibly somber mood. And when you go to their clinic, people are playing on iPads, ladies are talking, TV's going on, people are fine. Like everybody's fine.
Ping pong table and so it.
Right. Like everybody's in a good mood and it's a nice atmosphere and people are laughing and smiling and they know they're going to get cured, Patrick. And
incredible.
And the thing about it is that you go through there and you look at the technology and look at how they diagnose this and you look at the treatment and you look at how they're actually improving and how they're so cutting edge on how they're improving actually with AI and data and stuff like that. Like where they're going to be when I'm that age, I'm so optimistic about it. And when I left there, I'm like, you know what? If I had cancer, if I was diagnosed with cancer tomorrow, I'm not stressing about it. I'm not feeling like it's a death sentence anymore after going through that. And that's what I want to give to people. It's like, hey, we're going to do videos. I'm going to introduce everybody to the head physician there, the head oncologist there. We're going to show people once we roll this out how amazing this place is, because that's besides just having that insurance. I want to give people that peace of mind. You know what? Yeah. If I get diagnosed with cancer, I've got a great chance. I've got an amazing chance of being cancer-free because of this program.
Well, when we talk about certainty, it's all about knowing what the future holds, at least having some idea, at least being confident and optimistic in what the future will bring. So much of life is overwhelming. Rising costs, the unknown. They say that the biggest fear for most of us is the fear of the unknown. Mm-hmm. That's why we're afraid of deep water or the dark or death even, right? That's why we're afraid of public speaking. We don't know how it's going to go, right? And so not being able to worry or not having to worry about the unknown because you have a solution like LifeExec, Advantage Complete, a solution like this cancer response or solution, that I think can extend life in and of itself just by lowering people's blood pressure and lowering their worry and their anxiety. And, and we know there's a lot of initiatives out there these days that are taking advantage of tax savings and other things. And Congress is making those available because they want us to get more healthy. They know it's going to save billions of dollars for Medicare in the future. And, so it's, we started the whole thing talking about how the concept itself, the plans that you've been able to negotiate and put together, combined with the leverage of having these millions of a million different doctors, hundreds of thousands of facilities, et cetera, and then the technology that's tying it all together, making it work. It's kind of a perfect storm for the future of healthcare. And I agree with you. You may be first to market and you're going to get a big piece of the market share because of it, but others are going to follow, and they're already starting to take note.
You're right. I mean, we're going to be okay. I mean, LifeExec's doing great. It's all about, like, if we can drive change, that, and give, I always like to give an idea, and then, once it's out there, see where other people take it as well. And yeah, I'm very, like I said, there's a lot of selfish reasons why I'm doing this, right? I mean, I need healthcare too. And so we just, we're very nimble, as and we're constantly, pursuing better solutions, but we don't have all the answers and we don't have all the resources. So yeah, I'm excited to see, how once we're a very disruptive force in this, where others take it as well. I think we're in a time of probably some, at the precipice of some really exciting change and necessary change within the health plan and not only that, the healthcare world. We're going to talk about the cancer thing next. But I'll tell you our roadmap for next year will completely disrupt this space more so than we are now, like in ways that nobody's seeing coming, and we're going to be changing and improving the lives not only of our members and giving them access to better healthcare. Our next foray is going to be improving the lives and the business efficiencies of physicians. Physicians and insurance, it's terrible. And so if we can, and so think about that, if we're able to improve the lives of physicians, and we're starting with the members, it's ultimately going to come full circle. So it's like as we're improving the lives of physicians and making their businesses better, that's only going to result in better care for our members as well. And so it's going to become this really, really fun cycle of improvement. And yeah, next year's going to be more exciting than this year.
Well, we're very much involved and very committed. In fact, next month, November 15th, I'm going to be interviewing Jim Bland. He's the founder and owner of Seniors Home Services. Speaking of serving physicians better, right? You've met Jim. We've been talking about how to help physicians take work off their staff's plates, create additional revenues, serve their clients better. It's all paid for by Medicare.
It's great technology too. What that ultimately ends up doing for the senior is vastly important. So they're, dealing with, the studies that are coming out on loneliness with seniors and the negative, medical impact. I love that solution. Yeah.
Yeah. Well, it's all about doing more than just making income, right? Making a difference. And you're most definitely creating a legacy, Ken. And I know where your heart is. I know where your team's passion lies. And it's been really an honor watching it evolve and seeing where it's headed and just being, calling you a friend and calling you a colleague and, just know we're 100% cheering you on.
Better, right? Yeah. And like we'll all ultimately end up, being the beneficiary if the communities are strong. We're all the beneficiary of it. So that's what we're all about.
That's right.
In fact, it's right there, right? This is
right.
People helping people. Yep.
I wore my LifeExec shirt. If you're on the YouTube video, just in honor of
You're
you.
writing it. Oh, great. There it is.
Well, thanks for being on the show, bud.
Absolutely.
Always appreciate it.
Anytime. Let's do it again.
Yeah, we'll schedule again maybe after Thanksgiving. I think what you're bringing out is a great Christmas gift, and so let's do a Christmas special. We'll talk about the new cancer program.
Okay, if you want, I'll give you guys your listeners first crack at it. Then how about that?
Sounds great. I'll do your first interview. That sounds good.
Okay, see you later.
Okay, my friend. Take care.
Bye.
Thanks for tuning into today's episode of Finding Certainty. We hope you've gained some more insight into how to create more certainty in your own business or nonprofit. Join us next week for another taste of the certainty experience. Until then, we wish you greater certainty in all that you do.